Good morning, everyone. Good morning. This is Bill Miles with the Hilton Head Island-Bluffton Chamber of Commerce, and welcome to our weekly Teletown Hall. We're glad to once again have so many people joining us as we continue to provide timely and relevant information in an unfiltered way. We think that's very important each and every day, and certainly especially during the times of COVID-19. I want to remind everyone as we get started that you have a chat box on your screen, and please start asking questions now. You know the lineup of speakers, and if you have any questions that are on your mind, go ahead and put those in the chat box. Our recent poll of the business community, we saw that hundreds responding, and also that the number one concern remains safety. And so with that safety, I just want to remind everyone that the Chamber's Path Forward Readiness Plan has been developed. It was completed in just over 2 weeks, and would certainly like to thank all the 175 plus task force members that participated in that.
Sorry to interrupt. I just wanted to let you know that I'm about to connect Senator Graham to the call.
Okay, great. Thank you. We completed that in just about over 2 weeks. And again, a shout out to the task force members, the business owners, residents, workers, and faith leaders, as well as government officials that participated in that. And with that said, I think we have U.S. Senator Lindsey Graham on the phone. And Senator, we're glad to have you representing South Carolina. We're glad to have you on the front lines for what's going on in America. And we're glad to have you with us today. So we look forward to hearing an update from you. Ladies and gentlemen, Senator Lindsey Graham.
Senator Graham is now connected.
Thank you. Welcome, Senator Graham. We're glad to have you back on the call. We wish you were home in South Carolina.
Thanks, Bill.
Glad to have you in Washington.
Well, I wish I was home too. Very kind of you. So you want a little update here?
Please, sir.
Okay, so phase 4. I think there will be. There'll be some help for state and local government. It's not going to be $3 trillion worth. Before we spend money on phase 4, I want to see how phase 3 works. The big issue for me is liability protection for our businesses. Everybody in the Hilton Head Chamber is looking forward to reopening, but they've got to have some questions about what are the rules. What should I do to reopen safely? And if I do those things, will that protect me from being sued? So I had a hearing yesterday, Bill, about liability protection. We don't have enough guidance coming from the government to business. How do you open up a salon, a gym? What are the rules for the Clemson in South Carolina? How do you configure a dorm? If you're going to practice football, how do you do it? So I'm pushing the administration to push the states to come up with guidelines, to give you guidance, regulations, basically, how to run a business in the coronavirus era until we get a vaccine. And if you'll follow those guidelines, you can't be sued. Uncertainty is bad for business. And one of the things that's most uncertain now, what are the rules when you reopen in terms of liability? So take any questions you got, but the main thing for me is to give you more certainty when we begin to open up coming Monday. We're going to open up more and more South Carolina. On the therapy side, we're having some breakthroughs, I hope, by the fall. But my hope is that by the fall that we'll have therapies and a vaccine on the horizon. This really never gets behind us until we figure out how to treat it with success and a vaccine to prevent it from come roaring back. Till those two things happen, we're just going to have to learn to live with this and manage health and reopening the economy the best we can. So I'll be glad to take any questions.
Thank you, Senator. Our first question this morning for you comes from Alan, and Alan is asking if there's any progress being made on extension of the PPP period beyond 8 weeks for businesses who were closed for the first 3 weeks of its availability.
We're trying to work on a good question, because the 8 weeks is going to run out and you really won't have a whole lot of customer base. I'm working with Gene Shaheen from New Hampshire to extend the period. We'll see what happens. If there is a phase 4, that will be one of the things that I'd like to revisit, is expanding the 8-week period, because again, I'm not so sure the customer demand will be there. And two, to change the formula from 75-25 to something more flexible for the business owner, so that there may be other things you need to spend the money on, and 75% dedicated to wages. In some areas, like Hilton Head, is pretty high cost rent, to give you more money to pay other expenses. And finally, the unemployment benefit $600 supplement expires in July. We're not going to reauthorize that program to get more money in unemployment than you make it work. If we do that, you're never going to get people back at work. So this is a work in progress, is the answer to that question. You got to have Democratic buy-in.
All right, Senator, the next question comes from Mel, and Mel is asking if the $3 trillion that's being talked about in the House, if that has any opportunity to go anyplace.
The same opportunity I do of being in the NBA.
Good response. Good response.
I wouldn't. I don't like my chances. Okay.
All right. The next question comes to us from Nancy, Senator. Nancy's asking, when will testing be available for the general public to be able to screen employees before returning to work?
I think that's the really ultimate question. We've got testing at a level to do phase 1 where you have a partial opening. But by the fall, we need to have millions of tests per day available to Americans, starting with our frontline healthcare workers, nursing home people, the people most at risk. But if you're going to open up the University of South Carolina or Clemson, you'd want to have some idea how the student population is, right? Because you're asking people to live in dorms and all kind of stuff. So I'm hoping that by the fall, August, September timeframe, we'll be up to millions of tests per day, 40 or 50 million per month, or more than that, actually. So there are 2 type tests. Do you have it? Have you had it? And both of them are progressing. But just think about what we're asking science to do, is to develop a test that you can get back in 15 or 20 minutes for 350 million people. That's quite a challenge. But that's the key to really sustaining the economy until you get a vaccine. You want to be able to test your workforce. You want to be able to give confidence to the customers and come into your business safely. And the key to that is more testing. And I'm somewhat optimistic, more than I was just even last week, that by the fall we'll have that, but it's not going to happen in the next month anyway.
All right, Senator, another couple of questions for you. One's coming from Deborah, and Deborah's asking if any ideas on what the timeline for loan forgiveness rules are.
Well, the loan forgiveness, what do you mean by that? I mean, it's the 8 weeks. If you keep people on the payroll for 8 weeks, you can get a loan forgiveness for the 8 weeks. Is that the question?
Yes, companies are now hearing about the prospect of lengthy audits on the use of the funds.
Oh, I don't know about that. I haven't heard. I'll get back with you. That's a good question. I don't know. I mean, I think the mistake we made in the PPE program early on was that too many people got access to the money who were pretty liquid. The goal was, if you're a small business person, we've shut you down to protect the country from the spread of the virus, that we're going to give you a line of credit that turns into a loan if you'll keep your employees on the payroll so they don't go on unemployment. Unfortunately, a lot of businesses were able to apply for the money that were pretty liquid. So if there's a third round of PPE, it's going to be more community bank oriented. It's going to be more focused on Main Street, less on bigger companies. in terms of audits, I don't know the status of that, but I think we need to have a system to make sure people didn't abuse it. But if you're a small business, the last thing you need is an audit right now. So we'll try to make sure that's directed to people of means.
Senator, the last question we have for you is we're always asking you, the business community, the residents, of ways that you can help us, or ways that you can help us. And this morning, before we let you go, I'd just like for our listeners to ask you, how can we help you?
Well, that's really very nice. Nobody's done that lately. Just pray that I can, make good decisions working with the president, my Democratic colleagues. The main thing is keep me informed. The best thing you can do to me is tell me what's working and what's not. The PPE program was a good idea. It's had a lot of ups and downs, but generally speaking, I think it's going to avoid bankruptcies. Keep me informed about how the $23 an hour unemployment benefit is hurting getting back to business. Just let me know, Bill. Nick is on the phone here. Just call my office. I think you know how to get a hold of me. Just keep me informed of how I can better help you. This is unprecedented. I've never seen this in my public lifetime, of having to deal with taking a hot economy and throwing cold water on it and trying to restart it. We're going to get through it. The key is therapies and vaccines. There's a trial in Oxford showing great promise. But how to help me, just keep me informed about what I can do to help you. My goal is to be accessible at a time when you need all the help you can get, and to be part of your team. I just like my job today more than I ever enjoyed it, simply because it shows how you can help people, that my staff and myself, that we have a chance to really help people. I came from a small business background. My dad owned a restaurant, a liquor store, and a bar, and I ran the pool room as a kid. I know what it's like to have to work 6 days a week. You can't afford to get sick. And I've never forgotten that experience. So these phone calls really help. So just stay in touch and pray for me, but pray for the country. Pray for all those who are captured in these nursing homes and can't get family visits, and just pray that we can find a breakthrough for this virus.
Senator, we'll certainly do that. We appreciate you always making time for us, and we thank you for your leadership, and we appreciate your friendship as well.
Well, I appreciate all of that. I'll be in your area with my golf clubs and with a healthy appetite and ready to get outside. So I'm going to bring business to Hilton Head.
Very good, Senator.
Thanks.
Well, thank you so much for dialing in. We sure appreciate you.
Thank
Bye.
you, sir. Thank you.
There you heard it from Senator Lindsey Graham, and it's always a delight to have the senator join us for a call. We talked a little bit about how reopening government is taking place, and we thought today that it'd be important for our call to look at some of the sectors that are reopening. And our next speaker that we have is Rebecca Leach, and Rebecca is the executive director of the South Carolina Retail Association. We know how important retail is to Hilton Head Island and to Bluffton, as well as the state. And we're looking for a few comments from Rebecca. Rebecca, welcome to the call.
Well, good morning, Bill. Thank you so much. Thank you for having us, and thank you for including retail in the conversation. And I want to extend a thank you to Senator Graham for all he's done for our business community throughout all of this, with the access to funding, but also his commitment to working on the liability issues that he mentioned. That is definitely of utmost importance to our businesses as we restart. So a quick, who are we? Retail Association represents, as it says, retail across the state. We have members who range from your large big box stores to small boutique shops, restaurants, and convenience stores even. A lot of grocery stores and pharmacies are also included in our membership. So a quick overview of how COVID-19 has impacted us. Some of our retailers were required to close pursuant to the governor's executive order. Some were allowed to remain open, and mainly those that remained open provided essential products and services to our citizens as we navigated this. A big challenge for those that remained open, I guess, fortunately / unfortunately, they were having to navigate this in real time and figure out how to implement protocol and measures to keep everyone safe. So they had to be nimble and work hard to do their part as we stayed open. One challenge that I'm sure all of our customers experienced, as did we, was product shortages. And it was not because there was actual product shortage. It was due to supply chain issues. So as we all know, this is a global, national and global crisis. And so normally during a quote unquote normal natural disaster, say a hurricane, it's a regional thing for our country. And so our retailers are able to shift product to meet needs in different areas. Well, with this being a global issue or a national issue, we weren't able to really shift because we were having the same issues everywhere. And so with that combined with some product hoarding and excessive purchasing we saw through some customers, we had faced some challenges with the logistics of that. So we are hopefully coming out of that now. Hopefully folks have gotten all that they need and they're starting to feel a little bit more comfortable with the availability of product. As I mentioned, some stores were required to close while some were allowed to remain open. And then eventually, of course, the governor did allow those other retail types to reopen. However, he did institute across the industry some limitations, including an occupancy maximum of 20% of your available occupancy. Also required to, of course, follow social distancing guidelines as well as sanitation guidelines from CDC, DHEC, and others. So some issues that retail is facing today as we move towards reopening is recall. So we're having some challenges with getting some employees to return back to work. As we discussed, the increased benefits that some of our employees had access to help them get through this crisis. Those benefits are still available. So sometimes it is more economically advantageous for employees to maybe sit out for a little longer. But also there's just the concern of exposure and, everyone has their own unique situations health-wise and with their immediate contacts. And so, of course, there's concern with that and returning to work. And again, as I mentioned earlier, and as Senator Graham mentioned, liability. That's a huge concern for all business types as we reopen. What does that look like? Where are our vulnerabilities with this, and how do we navigate that? So we are working with the State Chamber of Commerce as well as the Manufacturers Alliance and the Hospital and Medical Associations. We've formed a coalition to develop some proposed language for our state legislature to take a look at to help make businesses feel comfortable with reopening, to know that they are protected with these liabilities, as long as they're doing their part to help protect their customers and their employees. Another thing, so I'm also serving. I've been asked to serve on the Governor's Accelerate SC group, and so you've seen as he's reopened different sectors, he's developed these guidelines, and so those are available to also help employers get their stores back in order to help protect their employees and their customers, and ultimately to make their customers feel comfortable with returning. That's our ultimate goal, is to try to make these folks feel comfortable. So where do we go from here? Those that have been able to remain open, or those who have reopened, have to invest in training for their employees. They have to take the time to, of course, go over these guidelines, look at their business model and determine what works best for them, and make sure their employees follow those guidelines, and again, to ensure protection for not only them, but for their customers. Other things retailers have to do is get creative. We have to find a new way to reach our customers. Some folks have online platforms, some do not. Throughout this, folks were allowed to at least offer curbside pickup of their purchases. Retailers were allowed to do that, so that was an extremely beneficial thing the governor did allow us to do. But now, we have to look at other ways to move forward. If you don't have an online presence, you may want to look at doing that. The governor did allow for temporary curbside pickup of alcohol, which was beneficial because, again, the ultimate goal was to, of course, try to prevent people from congregating and to allow for social distancing. And so by encouraging curbside pickup of groceries, and being able to include alcohol purchases in that was also helpful. And furthermore, was extremely helpful with our restaurants, who were really suffering throughout all of this, since they were required to shut down for in-person dining. They were allowed to offer some alcohol purchases with their to-go orders, so that was extremely beneficial. So looking at things like that, we're also working with our Department of Social Services to allow for those citizens who are SNAP recipients who receive that assistance to be able to purchase their groceries online with the SNAP benefits. Other states are moving towards it. And I know South Carolina is assessing now, so that's going to be a big thing for us as well to help our customers. And so where do we go from here? Stores are opening. They're doing their part to protect employees and to protect customers, but we need customers to also do their part. So, of course, first and foremost, if you don't feel well, please don't come to the store. Please stay home and limit your exposure. When you do come into the retailers, please use your PPE. If you have a mask, please use it. Use hand sanitizer. Also, please mind the signs and markers. A lot of stores have social distancing markers in their stores to remind folks about the distance they should maintain between customers. So we ask folks to please mind those, and also pack your patience. We know this is difficult for a lot of folks, and we know that it's overwhelming. So when you go to stores, please just understand we're all trying to navigate this crisis together, and we all want to do our part. So just pack your patience, and then of course, whenever you do visit a retailer, try to make it your shopping trip as efficient as possible. Have a list, kind of have in mind what you're looking for. So that way because we do have limited occupancy, we are allowing those folks to get in who need to get in. And at the end of the day, we're all in this together. So just know we will get through it. We'll all do our part and we'll get through it. And so with that, I'll be glad to take any questions.
Rebecca, thank you. And key phrase there, pack your patience. I think that's something we all need to remember. You had mentioned about PPEs and certainly the need and the encouragement for people to wear their PPEs. And are you seeing or hearing from most retail establishments? Are they requesting their associates to wear PPEs as well?
Yes, that's definitely a common request, and I'm sure you've seen from some retailers that they have mandated it for both employees and customers. So yes, we're definitely seeing that. And one thing I failed to mention, of course, access to PPE has been a challenge throughout all of this, and we're starting to see it become a little more available. The state has done a great job of creating this coalition of folks and created a website where folks can go who manufacture PPE and they can let the state know, hey, I manufacture, here's what I have. But conversely, we, the public, can go to the site and request PPE, request to purchase it. And what they do is they take this list of manufacturers and they vet them. They ensure they're legitimate and they do, of course, have proper product. And so whenever you go in and request this product, they'll send you a list of available vendors so you can reach out to those and find the product you're looking for. And so that's been an extremely useful resource for all of our businesses as we've been reopening.
Rebecca, that's very helpful and certainly great information. And we thank you for coming on today and sharing that with our listeners.
Well, thank you. Thank you so much for having me.
And we have the PPE. There's in the chat box there. There's the link for PPEs. So if anybody needs that, look at the link. And then also, if you were to go to our website, hiltonheadisland.org/COVID-19, you'll find local providers there that are offering PPEs. So Rebecca, thank you. And moving on to our next caller, we're delighted to have Dwayne Parrish back with us again today. And Dwayne is the Director of South Carolina Parks, Recreation, and Tourism. Dwayne?
Good morning, Bill.
Good morning.
I thought I'd give you an update of where we are and where it sort of goes from here from a tourism perspective. As of yesterday, we still have 155 hotels closed around the state. That is down significantly from last week. The majority of those, as you can imagine, are in Charleston and Myrtle Beach. But I anticipate over the next 2 to 3 months that number will continue to slide down to a very small number. Along those same lines, hotel occupancy last week around the state was 30.1%. That's slightly higher than the Southeast and the U.S. average at 28.6% and 28%. I anticipate it being a little higher this week, as I've heard organic reports of a little more corporate business and some leisure traffic coming back. Our Discover Now, Dream Now, Discover Later. My apologies. Dream Now, Discover Later plan has been in place since May 1st and does seem to be connecting with a lot of folks who are at least keeping South Carolina top of mind for their travel. That plan will go to a call to action phase, if you will, on June 1st. I thought I'd give you some highway traffic statistics to sort of illustrate where we are from that perspective. So highway traffic across the state, interstate traffic around the state is at 80% of normal levels for this time of year. Non-interstate traffic on the coast, and by the coast, I mean east of Interstate 95, is at 85% of normal numbers for this time of year. And lastly, Midlands and upstate non-interstate traffic volumes are close to normal. So we've certainly seen that come up quite a bit. I've seen interstate traffic below 50% when this was probably at its the shutdown, stay at home was in its peak, if you will. It has come back dramatically to see those sort of numbers. In our state's 9 welcome centers, we're seeing more traffic as well, as you can imagine, servicing more people who are back on the road with probably more questions than they've had before. In our 47 state parks, we had another weekend of heavy visitation. We reached capacity at 12 parks on Sunday. Surprisingly, none of those were on the coast. A lot of our inland parks are seeing local visitation for the first time, with a lot of people that have not been out before, primarily due to, I think, just the need to get out and some of the cabin fever. I do anticipate with warmer weather this weekend that number will go up, that the visitation will go up substantially this coming weekend. As you're probably aware, indoor dining was opened up for Monday of this week. The recommendation from the governor's office and from the South Carolina Restaurant Lodging Association is to be at 50% of capacity of your normal indoor count. That number is posted in all restaurants by the fire marshal. Those are not requirements, they're recommendations, but certainly I would encourage all restaurant business owners and managers to follow those, as people will be watching to see whether they feel safe or not to go back into these places. Most of the beaches on the coast are, with the exception of Hilton Head and Folly Beach and Sullivan's Island, are open with no restrictions now. And I believe over the course of the next week or so, that will likely open up the remainder of those. Also, all commercial swimming pools, including hotel pools, resorts, and the like, may open up this coming Monday. They would be at 25% of normal capacity. Again, DHEC posts a number inside or at each pool or resort regarding how many people can be in capacity. It will be actually a requirement, not a recommendation. They be at 25% of that normal capacity. Later today, our response group meets to go over our hotel plan in regard to meeting rooms, weddings, attractions guidelines, anticipating some of the attractions information. We're making recommendations for attractions to be opening soon, probably in phases as we go through that. There'll be several other things discussed, athletic fields and the like during that, but I wanted to bring attention to those particular things that apply to tourism. Also, as the senator mentioned, phase 4 is in discussion now. The CARES Act, the big push for a lot of us, and there is a bill on the House side, HR 6697, which would allow DMOs, which most of our chambers and convention and visitors bureaus around the state are, would allow them to qualify for the PPP program, which is Payroll Protection Program. Congressman Cunningham, Rice, and Wilson are all signed on to the bill. Jim Clyburn is also in support of the bill, but cannot sign on as he is a part of leadership. And then yesterday, in regard to business protection from lawsuits, Helen Hill testified on the Capitol Hill in front of the Senate Judiciary Committee, along with 5 other people, to talk about how small business needs protection from lawsuits regarding the COVID-19 virus. And so I think that's probably coming along with, as Senator Graham mentioned, probably coming along with the next phase of the phase 4, if you will, of the CARES Act. And lastly, I wanted to share with you there are several companies out there that track this sort of consumer sentiment in regard to travel. I thought I'd share this with everyone. So just about 4 or 5 bullet points here. So Americans are clearly divided about getting back to travel again. Americans are also evenly divided about welcoming visitors back to their own communities. And certainly we've sort of seen a lot of that in South Carolina. On the positive side, the downward trend slowly continues. for those saying that the pandemic will greatly impact their decision to travel in the next 6 months. Economic concerns hold steady at a low level so far, and that's whether they have the money to travel or not. And then lastly, pent-up demand seems to run to the wall of fear and regulation, as the intent to travel stays flat at around 70%. Bottom line, the good news is that 70% of people are willing to travel in the next 6 months. The bad news is 30% are not. But that number has held steady now for the last few weeks. So we get weekly reports of these. And so I wanted to share some of those with you. So Bill, pending any questions, that concludes my report for today.
Dwayne, thank you. That was very thorough. I'd like to just provide a little information to our listeners. While Dwayne was talking about statewide occupancy being around 30%, the Hilton Head Island occupancy as it stands this week is around 14.9%. So our hotel occupancy is currently around 14.9%. And if you want to equate that to bodies, that's about 696 guests that are staying in the hotels. That number is up from like 12% to 14.9%, and we're continuing to see some growth, but it's certainly at a very slow pace right now. But Dwayne, thank you again. We appreciate that, and we look forward to more updates from you.
Thank you, Bill.
Our next caller this morning is Dr. Michael Katka, who's back with us, and Dr. Katka is with SCDHEC, South Carolina Department of Health and Environmental. Dr. Katka?
Good morning, and thank you again. Thanks for the opportunity to speak. So as of yesterday, we are reporting 1,117 new cases of COVID-19 in the past week, which brings the total number of people confirmed to have the disease in South Carolina to 7,927. This includes 14 new cases in Beaufort County for a total of 282 cases in the county. No additional cases were reported in the zip codes 29928 or 29926. The total there remains at 29. Unfortunately, today we've also reported 59 additional as of today, we're reporting 59 additional COVID-19 related deaths in the past week. This brings the total number of people who have passed away from the virus to 355. No additional deaths occurred in Beaufort County individuals in the past week. I'd like to take a time to talk about our testing effort now. So a total of 89,968 tests have been performed in South Carolina, which covers about 1.7% of our state's population. Of those tests, about 9% of the tests have come back positive. So of all tests run, about 9% were positive for COVID-19. To assist with this effort, our federal partners have committed to providing DHEC with enough swabs and testing supplies to test about 2% of South Carolina's population for May and June. So our goal will be to test 2% of the population, or 110,000 South Carolinians per month. We're currently on track to meet this target by the end of this month. In order to begin the safe transition back to less restrictive quality of life and a vibrant economy, we recognize the importance of increasing access to testing in communities across the state so that we can detect disease activity and understand how well controlled it is. Widespread testing is important in every community because each of us continues to be at risk for exposure to someone infected with COVID-19. But enhanced testing is especially critical in rural and underserved communities where residents may have limited access to healthcare, transportation, and internet as an information source. So expanded testing will allow free testing for all residents and help everyone continue to take steps needed to help slow the spread of COVID-19. It will help us identify hotspots, catch outbreaks before they spread, and indicate where the resources are most needed. To increase testing in underserved and rural communities across the state, DHEC is working with our community partners throughout the state to set up free mobile testing and pop-up clinics to bring testing to those communities. We currently have 14 mobile testing clinics scheduled across the state, with more planned in the coming days. We will continue to inform the public about the location of the COVID-19 test sampling sites, including the mobile and pop-up clinics. That information is available on our website. With increased testing, there will be an increase in the number of positive cases reported. This means we'll need to increase the extent of our contact tracing, and we're prepared to do so, as I discussed last time. A little bit of update on that. We've enhanced along with increasing our testing efforts. We've set a goal with Accelerate SC to identify 1,000 contact tracers by May 31st, and we actually have already met that goal. So we currently have 400 contact tracers in the state, and we've retained an additional 1,400 who have been identified and will begin the process of being trained. I know by now everyone has the message about how to prevent spread through social distancing and hand washing, but please do continue to take those steps to protect yourself and others. And for the latest information on COVID-19 as well as the testing site locations, you can visit our website, scdhec.gov/COVID-19, and I'm happy to take any questions.
Dr. Keka, thank you. Very detailed report again, and we thank you for the updates. And we're going to move on to Jeremy Clark with the Market Chief Executive with Hilton Head Hospital. And Jeremy, as we lead into your discussion and what Dr. Keka reported on, in looking, if my data is correct, in looking at the 29926 and the 29928 zip codes on Hilton Head Island, there has been in the 26 zip code for about the last 8 weeks, the number has remained at 17, and then in 28 it has remained at 1 in the last 4 weeks. And then when we look at the Bluffton numbers, you've got a slight increase from last week to this week by 1, and the Okatee numbers remain the same. And I bring all that up to I know that you and Hilton Head Hospital and Coastal have gone to great extremes to prepare and to be ready. And I think as we continue to transition and reopen Hilton Head Island, I would like to hear from you, and I think our listeners would too, about how the hospital is moving forward now that you've prepared and you are prepared. Where do you see it going forward with regular business?
Great. That sounds great, Bill. And I think you're spot on in your numbers and kind of our thought process. You know, we spent so much time getting ready for this surge of patients that was going to come, and we remain ready for that. But we're also ready to provide safe care in our ER, safe care in our operating rooms today. We're also, going to stay ready to continue to advance care in our community and continue to bring a lot more services online. And just do things better than we ever did before. So, one of the ways we're looking at this situation is really an opportunity to get better. We believe that we've created an environment that's safer. We've created a way of providing care that's even better than it was before. We see it as a real privilege to treat our patients, for them to put their trust in us. And then that's why we're doing that. So we're really using this whole situation as an opportunity to continually improve and continue to get better. So, we are ready in case that surge of patients comes, but we're also ready to advance care for all the patients that are not dealing with COVID-19 specifically. We've had a lot of great advancements in just the last couple of months that are allowing us to continue to develop programs today and over the next few months and years as well. In April, just as recently on April 1st, we had the physicians of New River Urology, Dr. Rick Langley, Dr. Eric Gwynn, officially joined Hilton Head Regional Healthcare. And we're going to be working with them to bring on new partners and expand access to care throughout the community in new office locations. So by working with them, we will be able to continue to advance minimally invasive robotic surgery and state-of-the-art imaging for urologic issues. So very excited to have those guys working more closely with us. That was followed just as recently on May 1st. We had 4 outstanding cardiologists, Dr. Jay Callan, Dr. Cal Sharp, Dr. Jonathan McCabe, and Dr. Doug Westphier, all officially joined Hilton Head Regional Healthcare. Those guys have been practicing in the community with another group for up to 20 years, and they've chosen to align with Dr. Mark Lawton and Dr. Aaron Ford to create really the leading cardiovascular group in the community in Hilton Head Heart. And so we're going to be working with them to establish new offices on Hilton Head and Bluffton, Hardyville, and Ladies Island as well to support our advanced cardiovascular program here at the hospital, where we already have an open heart surgery program. We're doing emergent and elective cardiac catheterizations and electrophysiology as well. So really exciting developments there. And then finally, next month, the 6 physicians of Riverside Women's Care, which is really the area's premier OBGYN group, are adding an office on Hilton Head Island. This is a group that already sees patients in Bluffton and in Beaufort. They're going to be adding more partners to expand the care that they can provide. And they're going to be bringing their laborist program to Hilton Head Hospital, which means that anytime a pregnant mom shows up at either one of our 2 hospitals, Hilton Head Hospital or Coastal Carolina Hospital, there will be a board certified OBGYN already on site 24/7 to provide that care. So a lot of exciting things going on. These are very exciting times for our health system and our community. And again, we're ready. We're ready to provide care if we see that surge of patients at some point in the future. But more importantly, we're ready to provide safe care in our emergency rooms and operating rooms today, and ready to continue to advance care for community in our community for everyone, the vast majority of which do not have COVID-19. So, Bill, we appreciate, as always, the leadership from our state and our local officials. We appreciate the support for everyone from our caregivers. And I'd be remiss if I didn't wish everyone a happy hospital week that we are celebrating with all of our caregivers here this week as well. So with that, I will turn it back over to you.
Thank you, Jeremy. We appreciate it, and exciting news for the healthcare system. So thank you and congratulations.
Great, thank you.
Dr. Kaka, I think you're still with us. We did have a question that came in for you that I would like to ask. And on a recent meeting, it was stated that someone's having trouble locating the new cases on the DHEC website or finding current cases. Can you tell us how that someone can access these 2 critical numbers to monitor the progress or risk on a weekly basis?
So the new cases get reported in our press releases. If you Google DHEC press release, you can see the new cases that are reported for each day, and then the total number of cases. There's a testing page. Let me see how I bring it up. If you Google DHEC COVID testing data, that should bring you to the page that has all the information on all our cases. So you can find all the total number of cases and information by county and that sort of thing on that page.
Okay, very good. Thank you for that information. We'll transition now to Fred Green, and Fred's the president and CEO of the South Carolina Bankers Association. Fred and William Furman were kind enough, along with the SCORE representative, to put on the I Got the PPP What's Next program webinar last week with us. And Fred, we look forward to an update, and then we'll see if there are any questions for you after William does his report.
Bill, good morning, and thank you for letting me join you and your members this morning. Just a quick update on PPP. The SBA has been updating the volume of loans and the takedown in dollars at least once a week. And as of last Friday, around 190 billion out of the 300 plus billion had been approved. South Carolina numbers were around 2 billion. And I guess the takeaway from that is that the average loan size is well below half of the first round in the second round. And the demand is significantly less as well. So there's about a $2 billion a day takedown rate, and based on having around 100 billion still available, the availability for folks getting a PPP loan will be out there for another probably 6 or 8 weeks if those trends continue. So the message there is, if you have a small business and are interested in a PPP loan, the availability is there. The banks have cleared out their inventory of applications. They're still accepting applications and processing them. So again, that'll be there for a while. Senator Graham, earlier this morning, Bill, did a great job in talking about some other issues related to, now that you have the PPP, what are some of the concerns? He mentioned the 8-week period and the 75-25% rule. We, along with, I guess, my counterparts from around the other 49 states, our national trade group and other trade groups, have been talking to Treasury, trying to get them to expand on the 8-week and the 75-25 rule. And I think Secretary Mnuchin kind of cracked the door on last week on them looking at it. So with the strong support from Senator Graham and our delegation, as well as others throughout the country, hopefully we'll see some movement there. The final point I want to make, Bill, is on the forgiveness. You mentioned the webinar last week that Hannah arranged and facilitated. On there were, in addition to me and William, Mike from SCORE and Dean from his CPA practice. And those two guys had great detail knowledge on what was required in the application. All of us were trying to deal with this issue that the rules, the guidance, and the formulas and documentation requirement on forgiveness have still not been issued by Treasury and SBA. All of us said, make sure that you document. Can't emphasize enough to maintain excellent records on how you spent the money. And I guess the way I described it is on the original application, basically there were two areas that you put on there: your compensation or payroll expense over a period of time, and your occupancy expense, rent or mortgage payment. Those two factors determine the amount of the PPP loan. It is reasonable to expect that whatever comes out of SBA and Treasury, they will ask you to then update those two areas and then submit that information along with documentation. So if you look at the compensation part, document what you've spent during this 8-week period, or if it's expanded beyond your compensation expense, your occupancy expense, submit that on the application that's, again, yet to be developed, and that will hopefully target the amount of the forgiveness. There was a question about audits on that, and early on there were a number of high-profile public companies that, according to the rules, got PPP loans. Because of the high-profile nature, many returned those dollars. And then SBA and Treasury kind of strengthened their language to say that if you need the PPP loan to stay in business and maintain payroll, fine, that's what it's intended for. However, if you have significant capital and liquidity, as Senator Graham said, you may want to return that. And if you return it by the 14th, which is tomorrow, all is forgiven. So there's no requirement on audits. There was a statement that every PPP loan over $2 million would be looked at and reviewed. But again, the general thought is, if you're covering payroll and if you need it to continue to cover payroll during this period of time, you'll be okay. So, Bill, with that, I'll just stop and listen to William and then field any questions.
Okay, Fred, I just had a comment here for you before we put William on. It just says, please thank Fred and his colleagues for the great conference call last week regarding PPP. As a small business, it was very helpful, and that comes to us from Kim this morning. So thank you.
Thank you.
William,
Thank
we look
you.
forward to hearing an update from you, and then we'll see if there are any questions for you as well as for Fred.
Sounds good. Thank you again for inviting me to the call this week. Fred, you covered PPP very well. I think that gets folks up to speed on that. We are really seeing things settle down here at SBA. This is the quietest week I've had since probably early March. Now, with that said, my phone is probably gonna ring off the hook. But I think lenders are catching up. and things are starting to slow down. So that's, I think that's a good thing. I know the question has been asked earlier about the final guidance on PPP loan forgiveness. And we are hopeful, this isn't a promise or a guarantee, but we are hopeful that we will see that that guidance come out this week. And so I heard that earlier in the week, and it's Wednesday. I haven't seen it yet, but hopefully they'll get it out here later in the week. I know everybody wants to see that, both the borrowers, lenders, and trust me, SBA staff would like to see that as well. When it is published, it will be published on the U.S. Treasury website. And so that's a really good site to just look really on a daily basis, or check it out every couple of days. They continue to update that with information. So I'm going to change gears a little bit and talk just a few minutes about the Economic Injury Disaster Loan Program, where we are there. We've had over 40,000 advances made in South Carolina for almost $132 million. That advance is the portion of the Economic Injury Disaster Loan, or EIDL, as I call it, that does not have to be repaid. So they're making good progress on that piece of it. There have been 954 loans made, and that's not just loans approved. That's actually closed for $129 million. And so where are we? And this is a little bit mind-boggling, but there are currently 2.9 million EIDL applications in the queue, and SBA is taking actions to try to get their arms wrapped around this and get these taken care of. So they have hired 1,000 loan officers to help with this task, and they're actually seeking to hire more loan officers and support staff, including attorneys, paralegals, credit analysts, and other positions to help address that backlog. And not only the backlog of the applications, but then going forward, all of these loans have to be serviced. And so SBA is looking for people to fill these positions. If you're interested or know anybody that's interested in looking for a job in this industry, you can go to sba.gov or usajobs.gov and get more information on those positions that are available and actually how to apply for those jobs. The EIDL application portal is still closed to all businesses other than agricultural enterprises. Have not seen or heard exactly when the portal will be open back up to all businesses, but we are hopeful that is going to happen in the somewhat near future. I do know that they're trying to work this backlog down and try to get in a position where they're able to process these loans in a more timely manner. And so that's part of the delay. The delay is, again, they've changed the rule to allow agricultural enterprises to apply, so they are giving them the opportunity to get their application in for the EIDL portal as well. And so again, not a lot happened this week, other than we're just pushing through the applications on hand, making sure that all the businesses are aware that we still have funds available, and encouraging them to apply if they have not already done so. And so with that, I'm more than happy to entertain questions.
Thank you, William. And the first question comes to us from Brian. And Brian his question is, can we give bonuses to employees who come back using PPP money?
Yeah, that's a good question. I'm hearing that one a good bit. Whether you can give bonuses, if you can increase salaries, and the current final rule does not speak to that. And so, that is something that I think we really need to see the final rule on forgiveness and see how that is addressed in that final rule. But again, unfortunately, it talks the final rule, the initial final rule talked about decreasing payroll, but it did not say anything about increasing payroll.
All right, thank you. Next question comes from Lily. And Lily's asking this morning, if you didn't let employees go, does the loan pay for employees for 8 weeks? We have 2.5 FTEs that stayed, and it stayed that way. Now can we pay the 2.5 FTEs?
Yes, as I understand your question, I mean, it sounds like you still had those employees on payroll, and yes, indeed, and that is exactly what the funds are for, is to use those funds for payroll. It doesn't necessarily have to be an employee that you're bringing back. It just has to be for payroll in general.
Good, thank you for that clarification, William. Next question comes from Karen. And Karen is asking, what is the status of idle applications filed at the end of March with no response? The 800 number does not provide any information. So
yeah,
that's
a tough one. SBA understands that it's not able to give really a good status to those applicants, and at this point, there really is not a way for an individual applicant to get their status of their application other than calling the customer service number. And I certainly understand that customer service has very limited information as well. Part of the problem the problem is that, we have 2.9 million applications sitting out there. So it's a challenge. We are hiring more employees, and hopefully in the somewhat near future, we'll be able to reduce that backlog and be able to give a better status update to those individual applicants.
all right. Thank you. Can you provide the info for SBA loan services again?
The customer service line, that number is 1-800-659-2955. And you can also send an email, and this is one word, disastercustomerservice@sba.gov, and you can obtain information by email as well.
Okay, and the last question comes to us from Courtney, and Courtney is asking, how do agricultural businesses apply for EIDL? The website says it is only for agricultural businesses. And that comes to us again from Courtney.
Yeah, that's probably a little bit confusing. So Courtney, early on, the portal was open for all businesses except agricultural enterprises. And so when we started to run out of funding, the portal was closed. And then when we received the round 2 of CARE funds, we did receive additional funds for EIDL, and they recognized that agricultural enterprises had been left out and were in dire need of funds. So they opened the portal up only to agricultural enterprises. We hope in the near future it will be open to all businesses. So just stay tuned. Keep looking at the SBA webpage. You can also sign up for email updates from SBA at the bottom of sba.gov. So if you go to sba.gov, scroll to the bottom of the screen, there's a place there that you can sign up to receive email updates, and you can get that information when it becomes available.
Fred and William, very helpful once again this week. Thank you so much for joining us and providing the answers, and we always appreciate it.
Thank you. Thank you
Thank
so
you,
much.
Bill. Thank you, Bill.
You're welcome. Now moving on to our last speaker today, and we thought we would conclude the call with certainly exciting information and to hear the latest from what's going on with the RBC Heritage from Tournament Director and our good friend Steve Wilmot.
Bill, good morning and thank you. I really appreciate you having me on today and joining this great group. I'd like to first thank really all the presenters today for keeping us safe, keeping us informed, and all the support and efforts that they give this community, but certainly the state of South Carolina as well. But an exciting time here, 35 days and counting. It's the new countdown. as we return to golf, as the PGA Tour has been talking about. But we're full steam ahead. The staff, as I mentioned before, you can certainly pull the plug overnight, but you can't plan overnight. And with the support and efforts of this community and the state, we are fully engaged and ready to get going here in June 15th through the 21st. But one thing is just as an update, as Bill asked me to give, was just to let people know that the safety and well-being of this community and all is the utmost of importance to everybody on this call, but certainly to ourselves, the PGA Tour, the state of South Carolina, and this community. And last week, just as an update, we had a call, which was a return to golf update call with a health and safety plan that was a draft at that time. But we had the pleasure of joining us was we had from the state of South Carolina. Dwayne joined us from PRT, had a couple representatives from DHEC. We had both our mayors and both our town managers and their teams on the call as well. Bill, our sheriff, PJ Tanner, was on the call. Jeremy, who's been tremendous as well with your support, Jeremy. Jeremy was also on a call with the tour again this week. And then also on the call was Sam Bennett with CSA, and then Steve Birdwell with the resort and their teams as well. So I really appreciate their time and efforts and being a part of this process as we continue to. It's very fluid, but the sensitivity, obviously, being the safety and the health and well-being of everybody is utmost importance. And some of the advice that Jeremy's been able to give us and testing and some other things has been tremendous. And I also like to thank the Sea Pines community and the resort again too. Their flexibility, knowing that the clubhouse and the footprint down there on their campus will be somewhat under a bubble, but but the flexibility they have, knowing how important, how great this will be, working with the network and television, it's going to be exciting for this community and the state. Also last week, just as an FYI, we had a call with the governor along with the commissioner of the PGA Tour. Dwayne Parrish sat in that call. The president of CBS Sports, Sean McManus, was on it, as well as Simon Fraser from the Heritage Classic Foundation. And that was a very positive. The governor and the support wanting to have this event happen was tremendous. The PGA Tour wanted to make sure they wanted to be here. They wanted to make sure that we were doing everything that we can possibly do to make sure we have the safest environment for everybody. And then CBS Sports was extremely excited, and they actually were here yesterday doing a site visit. They're excited about the return to golf and being Hilton Head Island and this community in the state of South Carolina. So a lot has certainly been happening, and the work continues on a 24/7 basis with our staff, working with the tour, working with this community, many of you on this phone, and we're in this together. We've got this, as we've told the tour. It's an honor and a privilege to be even offered the opportunity, and we jumped at it, and we feel it's going to be an exciting time. It's certainly a different feel, but it's going to be an exciting week for all of us, and get us back to some, hopefully, a little bit of normalcy, even though we'll be a little bit of the new abnormal. But again, I appreciate everybody's continuing support, and we look forward to working with you and seeing a lot of you real soon.
Steve, thank you. Great update. Thanks for dialing in this morning. I'd like to remind everyone that the pathforward.org, where you can find the readiness plan there in Flipbook. Please take a look at that if you haven't. And then if you have any other questions or comments, please send those to pathforward.org. You can email those to pathforward.org. That concludes our call for today. Thank you for being with us, and have a great rest of the day. Thank you. Bye-bye.